Good evening, everybody, and welcome to the Board of Health meeting Monday, December 20th. We have no appointments scheduled. We'll jump right into the action items. Approve disposal work permits for 3 Daisy Lane, 4 Daisy Lane, and 2 Cameron Way. And Jean Marie, there's okay, so we've got,
You know what,
Okay,
I think I
with
might
lot
be
15.
missing one of the Daisy Lanes in there, because I only found 2 files in the to-be-signed pile.
Oh, well, there was 3 and I took one out,
Okay,
They
so
both
we've
were
got-
all set, though, I believe.
yeah.
okay,
I
we,
have 3 here, and I have Cameron Way.
yeah.
Yep.
So 4 Daisy Lane, is that a push? Or is it just not in here?
No, I think today was a little crazy because she had perks, so we have a pile where the approved stuff is to make copies of,
Okay.
and it was just not in there, but she has approved it.
That's
She
new
pulled it out for
construction,
something
yeah.
else, yeah. So she did already review them, and she did recommend them for approval, it just wasn't in the pile to be copied when I went to make the copies today.
Okay.
It did get us tad crazy up there. 2 Cameron Ways, repair with no variances,
Okay.
so that one I signed off on. like
Okay,
the policy left.
so, and that's what we discussed last meeting, that you're gonna, okay, perfect, all right. Okay, so I'll entertain a motion to approve the disposal work permits for 3 Daisy Lane, 4 Daisy Lane, and 2 Cameron Way.
Motion.
This motion Matt, second Lisa. Any discussion? All in favor, say aye.
Aye.
Aye, so that passes. Okay, so then we have invoices. Yikes. Okay, so Massachusetts Health Officers Association, this is obviously to add Jean Marie to the team, okay? And Crystal Rock,
And the commissioner's payroll, it's not a bill, it's just a payroll form, so that will.
okay. Now, will I see that on Friday?
Yeah,
Okay.
just wanted to have you vote on it.
Perfect. Okay, so I'll accept a motion to pay the invoices as presented.
Motion.
Motion Matt,
Second.
second Lisa. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye, so that passes. Okay, so we have minutes. This is the chair, isn't it?
That's the chair.
You got the
I
chair?
swear I didn't move it today.
Okay, no worries, you don't, that's
Yeah,
all right.
I'm gonna blame Peter on that one. He moved it.
All right. Okay, so the minutes. Yeah, I did get a copy. Do we, so it's, the ones that you sent us, right?
Yep, November
Okay,
15th
so-
and December 6th.
All right, so I read them, I'm good with them. So I'll make a motion to accept the minutes, as sent.
Seconded.
Second, Matt. Any discussion? Hearing none. All in favor, say aye.
Aye.
Aye, passes. Okay, so we have a couple of more permit renewals.
On the back of your paper.
Oh, very good. Okay. Mr. Spagone.
So we have 2 body art places in town.
We do.
Yep, that'll be on discussion for the late submittals. One of our body art facilities has not submitted any renewal applications yet.
Okay.
So at some point you send out a punch-out?
So we already emailed,
Well, we already-
sorry,
yeah,
my,
that's- yeah.
excuse me, I usually text her a meeting, but my
That's okay.
groceries are at my front door and they can't find my house.
Good news is it's cold enough.
I have a long driveway. I sent them 2 email reminders.
Yep.
With the email that we have on file, which they've recently used. So at this point, you know, this is the second year we've had an issue with this same place, so that would be on a discussion items to talk about how we can handle this.
This is one we just approved, like, I wanna say September or October of this year. Didn't we just do an approval of a body art?
This is the whole thing, establishment, practitioners, the
And we
whole,
must just did an
the
artist.
whole kit and caboodle, yeah. Haven't gotten one application.
That's number 3 we can talk about.
Okay, and at some point in time, their day-to-day becomes at risk,
Yeah, so
and that's where enforcement.
that's what we'll talk about. We'll see what the board wants to do, for Jean Marie to do.
Okay, so with this list, I'll make a motion that we accept the 2022 permits renewals as listed.
Second.
Okay, that's the second, Matt. Any discussion? Okay.
Any problems with any of these permits that we know of, or these all pretty much good to go?
These, not on the list.
No, any of the ones that are on the list, we're all good.
Yeah.
Yeah.
Okay, cool.
Okay, I'm sorry, did we have a motion, Matt?
Yep, you made it, I
Okay.
seconded it.
All right.
For discussion, I asked them, but
Gotcha. Any other discussion? Hearing none. All in favor, say aye.
Aye.
Aye, passes. Okay. So for discussions, we'll take these, this first bullet point, we'll take this in 2 chunks. First, COVID test kits. We had an opportunity with the CARES Act money to purchase in-home test kits, which the purchase is made, and I'm gonna, Jean Marie, if you and Sue can bring us up to speed on that
Okay.
process and where we are.
So we ordered them on Thursday. They were supposed to be shipped out on Friday, but they weren't. And he'd tell me by 6 o'clock when they're being shipped, what the status is. They were gonna overnight them. So we're hoping they'll come in on Wednesday, by Wednesday,
Okay.
and we're proposing a drive-through handoff at Town Hall for 2 hours, like from 5 to 7. I
on,
honestly don't think they're gonna last much longer than that, so
on Wednesday, is the plan?
probably on Wednesday, yeah. The other option is Thursday, but I feel like we're getting a little too close to Christmas.
So what is the criteria for pass out? Are they East Bridgewater residents only? Do you get so many per family?
They will ask to show a license or something that shows they live in town, and 2 per household, which is 4 test kits.
Which is while supplies last though, right? 'Cause we
Yeah,
don't have.
just while supplies last. And then for I've decided, I talked to Nancy Hill, who runs the Council on Aging. We're gonna throw 1 test kit, which is 2 tests, into each of the Meals on Wheels, thinking that they don't have the opportunity to jump in a car and get down here. So that's what, and also provide with written instructions, maybe in a little bit bigger print in case they need that type of arrangement. So that's what she had suggested, and I think that's good. I think that will take about 40 out of the stream. And that's not a ton.
So the timing of our communication and executing the actual drive-by with distribution. So when will we know that these are definitely gonna be here on Wednesday?
Well, he's supposed to be sending me an email. I emailed him at 4 o'clock when I got in. He said he would be telling me by 5:30.
Tonight?
Yeah. That's why I
Okay,
brought my
alright.
phone down just in case.
I just don't wanna send out the communication and.
I
have
know,
us
and
right, so-
I'm very conscious of that myself.
Yep, good.
And he hasn't responded.
And then some of us are gonna be here on Wednesday evening, so there is volunteer opportunity.
Right.
You know, if folks are available, things like that, and if there's other folks that, you know, want to help out, by all means. Okay, so right now, we're just waiting on,
Delivery.
and we've had communication with both, or different departments, the fire department, police department. They're gonna be receiving a number of kits as well, each department, for
Yes,
their employees?
yes.
Okay.
And we're hoping that people come in, the directions will be come in on Plymouth Street and queue up that way,
Right,
and then go out North Central.
okay, great.
So you have a longer leg on Plymouth Street to have cars in, to line up.
Okay,
And we'll have them available on Thursday during the day at the Board of Health office. And then I think any that we have left, the police department said they would take them.
Are we sending additional instructions, or are they just going with what's
There's,
off the-
there's instructions in the kit that are very specific,
Mhm.
very, very good. So that was it. I was gonna send the notification out, put it on the website, reverse 911, and what do you usually use?
Did the press release go out?
Not yet, no.
Yeah, so the press release, that company usually distributes it to, like, they distribute it to the town website, right, Rebecca? The PR firm, you do it yourself?
They
Okay.
might start doing it, but not.
Yeah, so we'll get it out to all of our,
So that will go out
Social
probably
media.
tomorrow,
as soon as we have a date, right?
Yep.
Yeah.
as soon as we know they're shipped. So,
okay. Any other questions, comments regarding the test kits? And obviously, there'll be more communication to come in the next couple of days. So the second position on the first bullet point is the uptick in COVID cases, and obviously the latest variant that's wreaking havoc in communities. So there's been some discussion, and I'd like to have a discussion amongst the board members, and then possibly a vote, and then obviously, Jean Marie, would like to have your input, what your guidance is on recommending that the Board of Selectmen institute a mask policy here in town for municipal buildings. So that's where we're at right now, so do you wanna lead the discussion, and then,
Sure. Just to give you some feel for what's going on, we've had over 200 cases of COVID in the last 2 weeks. We had 85 last week, and we haven't got our weekend numbers in yet. It's Monday. Things get reported on Monday and tallied in. So we're definitely on an uptick. But I can tell you, about 90% of the visitors to town hall are wearing masks. I mean, they're very much conscious of that, and they are wearing masks. I would say probably most of us in town hall are not, unless we go out in the public. I wear them when I'm out doing food inspections and when I'm in close quarters with people. So I'm conscious of that too. There's a little blip on the health agent's update that just talks about breakthrough cases. Finds 97% of COVID cases in vaccinated individuals do not result in serious illness. So 97 people that are vaccinated are not getting a serious COVID case, which is really, really good. I mean, both for the town and far as absenteeism or as people that are getting sick. So that's good. So I would probably say not make, you know, you can either go with a recommendation to wear a mask, or you can go with a mandate. And I think that's up to the board. Where we have so many people that are trying to wear masks, I would probably suggest a recommendation for a mask. Especially if you can't socially distance and stay 6 feet apart. But I'm finding most people are wearing masks.
yes?
Yeah, like she said, what I've noticed also is that the people who are paying attention and want to follow any sort of advisory are going to, regardless of whether or not we have an advisory. And the people who aren't going to follow advisory are just going to not follow the advisory. So unless you want to put people in a position of having confrontations about masks, I think letting them do what they're doing is probably safer for our people.
Okay.
If they're gonna wear a mask, they're gonna wear a mask. If they're not, there's not nothing any of us are gonna tell them that it's going to make it easier.
Again, this is just in municipal buildings. Lisa?
I guess I agree with the group. I think unless the state goes into a mandate, we should just allow them to wear a mask if they would like. Otherwise, the office is gonna get flooded with phone calls about people being seen like they were last spring.
When the mandate was lifted.
Yeah,
Do you think if we put out an advisory, we would have the same call? Like say, hey, just a reminder that even if you're vaccinated, if you're in public, maybe you should be wearing a mask, sort of thing?
I mean,
Like a lighter language sort of thing?
I think people that are wearing masks because they're concerned will continue and have been, and people that don't will be confrontational and try to push back.
Yeah.
There's too many positive and negatives with vaccination status, non-vaccination status. Can you get it, can't you get it? I think people who want to be cautious and be safe will wear their mask, whether what we give them an advisory or not. I would think maybe it would be more effective to give an advisory to push for the vaccine, stating that most of our cases in town that have had vaccination status have less symptomatic, and, you know, that seems to be the benefit of it. But again, I think if we set forth any type of mask mandate, even if it's municipal buildings, then people outside of, well, why isn't it this, and why isn't it that, and I was at this restaurant, and I was at this store, and it's just gonna be a ton of calls for you guys at the office saying, well, that's not what it is, so.
Okay. So, okay, so I'm gonna make a motion that the board recommends a continued advisory for mask wearing inside municipal buildings opposed to a mandate. And then.
We don't have
we don't
an
have one to
advisory,
start
though.
with.
We only have it for
Yeah.
unvaccinated.
We made no suggestions when they repealed the mask mandate. We said nothing at all.
Right, but right now, we're moving forward to ask the Board of Selectmen we're recommending a
But we're not.
advisory.
I think we generally decided we weren't recommending that because of the,
Okay? All right, so there's no second, so the motion does not move forward. All right, so next item. Fiscal year '23, put some preliminary numbers together for the board to look at. We do have some deadlines that we want to, or we need to meet early January. So from what we see here, we just want to flush out a few of the numbers that came back as preliminary versus actual, so where we are year-to-date, and then where we closed on actuals for last year. And then once we see where the projected versus actual versus projected, and then where we are year-to-date on some of these accounts, we can get a better idea as to what the final number will look like. So you can take a look at this if you have any questions or comments. I'm gonna send a copy of this to Charlie, and then we'll work with the treasurer to get some actuals from last year, and then year-to-date this year. Somebody have?
Yeah.
Go ahead.
See, I wouldn't send it to Charlie quite yet, because there's some contractual things on here that we have to.
Yep.
address. Yeah.
Yep, it's, like I said, this is just a first glance, it's not a hard number. We still want to look at some numbers where we actually came in at, where we closed at versus projected, and then where we are year-to-date, and if we can extend that out to see if we're going to come in under or over. Excuse me. Okay, so the next item, license and permits that are not renewed by expiration date. So this is one of the concerns with one of our tattoo parlors in town.
Body art parlors, yeah.
Okay,
We haven't, they have not renewed, neither the establishment itself nor the practitioners,
When does it expire?
December 31st. I think the foods are okay, right?
As of just tonight's meeting, we have one residential kitchen that thought she had till the 31st. She will have it in, but not by tonight. So
That
the
was my
rest of them-
second question. So it is delineated in their contract or whatnot? that
They
it
have
has to be done
expiration
by-
dates, but, so when we send out the renewal notices in November, we gave them the deadline of December 10th, knowing this was our last meeting of
Okay.
the month.
All right, I see what you're saying.
That's actually in your regulations,
Yeah.
that they submit the application by December 1st.
Yeah, I was just making sure
Or
that if they didn't
food.
think like, oh, it's the 31st,
No,
like me, I'm
Yeah,
gonna pay
yeah,
it
the
on the
permit
30th.
expires on the 31st, right, yeah, so, we did have, I don't know if it was last year, I think it was 2 years ago, actually, when you were the chairman, I think we issued an order of noncompliance to the same parlor and told, because they were operating without a license for 10 days. So it's not a new problem.
I would not recommend that you let someone operate without a license. It really shouldn't be done, whether it's food or anything else. The only one that we don't require to, and it's in the regulations, it's not a deadline that we set up, okay? Food regulations say permits are submitted by December 1st, it expires on the 31st. Would be the installers, because they typically do not pull a license till they do the job. Because some of them might not do a septic until the ground thaws. So they're the only ones that don't have a deadline like December 31st.
Has there been any correspondence from them as to why they haven't renewed?
Nope. Also to let you know that I looked at the inspection report for the body art. They haven't been inspected in a couple of years. And in the inspection report was not, needed to be tightened up because a lot of things in there were not, it wasn't our inspection report and it didn't reflect our regulations. There were a couple of different changes. So both places will be getting inspections in the next 3 or 4 weeks. So if you get any pushback, that they haven't been inspected in a couple of years.
Okay.
And I will be visiting them.
Typically, that would be an annual inspection.
Typically, yes.
Our regulations say biannual.
By
Okay, so, nope, so it's like food every 6 months or so.
Okay.
So I guess the question is, what do you want to do about people that haven't renewed?
I don't know, I would think that if it was something that they were having difficulty with, then they would be in communication with us, and where they have not, they're just disregarding it. So perhaps issuing them a letter saying effective December 31st, their establishment is closed pending inspection and re-permitting,
Mhm.
and not being able to operate until they get their inspection.
So if they're open after January 1st, they'll get a visit from me
Yeah,
for the closure
I mean, because then they would be operating
without a license.
without a license, and then if it's not in fruition for you to get in there within that small time period, then there could be numerous issues, as opposed to 7 or 10 days you get in there, you know what I mean?
Right.
And they
right.
don't work until then.
Okay.
How do we enforce that?
A letter of
It's
closure.
letter of closure, and then if they ignore the letter of closure,
It's court.
right.
It'd be a court case.
We have a non-criminal disposition bylaw, the Board of Health. So Jean Marie can issue an order with a $50 a day fine.
Okay.
And as far as I understand, the fine would be coming back to the board, and the board would decide whether or not to enforce it. Like a parking ticket goes to the town clerk.
okay, so we would set that for January 10th, next time we meet.
Yes. But my order would say they're immediately closed,
Correct.
and then you're called before
Yep.
the board.
Have
Okay,
we
that's what they-
tried calling them? Or if this?
I've emailed them twice. So
Okay,
this is
all
not
right.
like, and if this was like the first year this has happened.
Fair enough. So
we
it's-
did, yeah, we did discuss it. So should I
Yep.
hold their hand and call them again, and we said, you know, their licenses all say they expire the 31st, this is nothing
No,
new.
and that's what I was saying, it
Yeah.
would be different if it was someone
Yeah.
saying like, geez, we had somebody out because of such and such, we're running behind or whatnot,
Yeah.
but where they're
And-
just blatantly disregarding any.
And in actuality, over the
correspondence.
summer, when I had the senior citizen work-off helper here, we went through all their files to make sure that they all had their third Hep shot, because that's one of our requirements, and there was a few people that needed to have it this year prior to January 1st, we sent a reminder about that out. So there's been communication, so, you know, it gets to the point, you know, how much should we be doing for somebody to make sure they're in compliance with their. And I think the bigger picture too is we were asking the board to decide in the future, like, so next year when we mail out renewal applications, you know, if you don't have it in by this date, there will be a double fee or a fine, because you don't meet again, so even if they get their application in, what if you vote for whatever reason not to issue the license on January 10th, you know? What if, you know, the application is deficit of something, or? So we were kind of looking for like a policy going forward, and we don't have to decide now because it's the end of the year, but like for next year, you know, do we tack on a late fee? Does the Board of Selectmen's office do a late fee at all, or no? But you have.
So out of all our,
We've had problems in the past when we sent them our, you know,
Yeah,
back money
yeah.
to open the doors in January.
Okay,
Usually they comply, but.
okay.
so we're gonna send them, do we wait till the 31st? Or we're gonna send them a letter of closure that they will be closed after the 31st,
I would send it now that they would be
Yeah.
closed.
right?
Yeah.
Because you're allowing the opportunity of them sending something back saying, oh, well, this one needs this one needs that. Well, you had all this time to do that, so. And it's holiday time, so.
So send them the letter and then
Right.
we'll see if we can shake the tree a little bit. Maybe
So
that'll
just-
get their attention.
You close them and then they get the right to a hearing, they have to apply before.
Our next meeting.
Yeah, exactly.
I mean, at this point, we can't approve them, we don't have a meeting till the 10th, so.
Right.
No, and we have to go through each practitioner's that's there and go through the hepatitis.
So as of the 31st,
Series.
they are closed, because they haven't been,
All right.
yeah, just so we're all, like, the wording is what it is. It's not, you will be, you are going to be closed on the 31st, and you can appeal for
Right.
reopening on the 10th.
And they're not affiliated with another town's body art place, right? They're their own.
I didn't know that was something you could do.
Well, I know you can have different locations, but you
Yeah,
have
yeah.
to still maintain your own town
Yeah.
stuff. I was just thinking if they're
Right,
thinking,
right.
well, we have one here and we've already.
Some of the
sent it out.
practitioners may have licenses in multi-towns,
Yeah.
I don't know.
But they have to be licensed in the
Yeah.
town that they practice in.
Okay. So the next item is a nonprofit food operations. We have, obviously permits for, you know, the trucks that come in, the for-profit trucks. So it's my understanding that we don't even inspect or issue a permit for the non-profit. So,
So that's stuff like your Lions Club
Right,
trailer,
right.
your East Bridgewater Vikings trailer, I don't know, there's a couple,
Churches?
off the top of my, I think Rob has been into some other churches if they've applied, if they are preparing food and have applied for a permit, but we don't charge them usually.
and I think that's, you know, if we're inspecting the for-profit, we're inspecting them for overall safety.
Yeah, it's a health and safety
Right.
issue, yeah,
It's not a revenue stream.
no.
But I guess my question is, why wouldn't we do the same why wouldn't we inspect the nonprofits, but not charge them the fee? Because we want to make sure that all food service providers, you know, operate in a safe and healthy environment.
I think the reason had been, first of all, most of them are volunteers, so they're not going to go take serve-safe classes, so that's one of the requirements of a food service permit. And some of those trailers probably, although they might follow health and safety regulations, probably don't meet the actual code for a food you know, a mobile food establishment. So it's, I think they've only popped up at Christmas on the Common. The Recreation Commission used actual licensed food trucks this year. You don't,
Used to be when we did the,
Church
the
dinner,
Buds
Methodist church, I think,
concerts,
has a
there
church
used to be
dinner.
like a Lions Club truck out there, right?
Yeah,
So
yeah.
Anytime you see the Lions Club truck out,
So are we talking about actual trucks, or are we talking about the snack bars?
No, well, the snack bars don't have a permit either, so that's
Yeah,
another, that's the
snack
other,
bars would
yeah.
be included in
Same
this,
thing,
but
yeah, like the
right
baseball
now we're
field and the
talking
football
about, like,
field.
There's a
Same
trailer
thing.
that they tow behind and.
So, going back to ServSafe, is everyone operating there required to be in a ServSafe, or is one ServSafe enough to oversee everyone operating there?
You have to have someone who's ServSafe certified.
Present.
Present,
Present.
right? Yeah.
They can train other people under them. But the other reason for that would be if they don't meet the criteria, then you have the right to limit their menu
All right.
to hot dogs that are already cooked, or, you know, sandwiches they bought from some other, from someone who is ServSafe trained.
Yeah.
Do we know what other towns are doing?
That's what other towns usually, I've always inspected nonprofits to make sure they hit the same standards.
How do we ensure things like snack bars and trucks have a ServSafe certified person when they're there?
Problem.
That's a huge problem, as
They
you know.
won't get volunteers.
As I
They're not
know.
gonna get enough volunteers.
And I
as it
think
is.
that's
Yeah.
why we never did do it, is because it was hard enough to find people to volunteer their time there to begin with.
Yep.
So what they do then is you then limit the menu so it doesn't need ServSafe. Like, I don't know if anyone's cooking raw sausages, for instance.
No, but they might have frozen
Burgers, hot
hamburgers.
dogs,
Burgers
yeah.
and dogs.
The hamburgers,
Chicken.
you
Chicken
can, you can
fingers.
now get chicken and hamburgers that are pre-cooked, and you're basically just heating them like you do a hot dog.
Hmm.
And that's what I think a lot of places are doing now.
I would be interested to reach out to like Bridgewater, Whitman, in those areas and see what they're doing
Okay.
before we implement something.
Right.
Because I know that most of these snack bars struggle to get people in to volunteer as it is, as
Right.
we both know.
Yeah, I can speak, we had this discussion at the meeting, the Little League meeting last
And
week.
I get the whole ordering a different component of food, but they're all set up for like their friolators, they're this, they're that. So it would kind of like revamp their whole structure. And we're talking about multiple things in town. I know baseball did get inspected for their new snack bar, but not for their food
Yeah,
distribution.
the building inspector.
Yes.
Building
um,
inspector and fire inspection happened at the new snack bar, but not health
Not for food.
inspections.
Yeah.
ServSafe.
Because there's the soccer field, there's football, there's baseball, there's the high school. I mean, I'd hate to impose something that's gonna shut down programs or put a financial burden on them, because most of their revenue does come from their snack bar. So just interested in seeing like if Whitman, West Bridgewater, just our neighboring towns, if they're implementing that and we're the oddball, or are they doing something different?
All right, so we'll push this to the 10th, and we'll do a little bit of research in some towns around and what they do, and if there's been any negative impact on the organizations. Because again, that's not the object, is to negatively impact anybody or create a revenue stream. It's just to make sure that the operations are safe.
Right.
Okay, all right, so we're gonna put that on for the 10th. And let's see, we've got, Jean Marie, do you wanna just go in a little bit more depth about, some of the updates that you have?
Okay, you've done the new septic permits, mostly it's Daisy Way. Central Street will be coming in soon. You did Cameron Way. We talked about revising the inspection report for body art and then enforcing East Bridgewater's regulations. And I will get to those in the next 30 days or so. COVID numbers have exploded as expected. You have an attached release from DPH regarding COVID variants and the vaccination rates and how successful that has been. We have, I finished perks and observation holes at Industrial Drive for the potential up to 15 lots. It's an old sand and gravel pit that's, what did you call it?
Ritterville, down in Tri-Town.
Down by Tri-Town,
Yeah.
down by Ritter, the, that area.
Yeah.
I did 12 septic inspections this week. A lot of them are trying to get them in, you know, before the ground freezes. We have an upcoming COVID clinic, January 13th. It's by appointment. It's at the Council on Aging. And in the past, our office will help anybody Sue's great at this. Any seniors who can't get appointments on the computer, she'll help them with that.
It's just for booster shots.
Yeah, it's just a booster. And then talked about the COVID rapid test that'll be given out this week. Check the website for the date. We're hoping it's Wednesday.
Can we revisit the COVID stuff real quick? We're one of the only departments, and there's been a couple of departments that have been very publicly saying something. I don't think we need to say, make an advisory, but we should say something. Whether it's a reminder or we have to have some sort of voice here. We can't just sit silent and not say anything at all. There's been enough, the Brockton now that has a mask mandate in all town buildings, I don't think we need that. We shouldn't sit quiet. We should say something, whether it's giving the Board of Selectmen the advice of.
Well, I
just
agree, I
remind
thought that's where we
people.
were headed, and
I think advisory is strong.
Yeah.
I think
Yeah.
we can say something. I don't wanna put people in a position where they're gonna be fighting with people that don't wanna wear a mask. I don't wanna sit here quietly and twiddle our thumbs while
Well, I
everybody else
think we
around us
can
says
always
something.
just put out the update that the cases are excelling.
Right.
And that the safest thing to do would be to get vaccinated,
Mhm.
maybe post a couple places that they could go to get vaccinated, and then at the end, as always, we recommend that wearing a mask and washing your hands and whatnot, social distancing are the most effective way, like something along those lines.
So I don't know if it needs to come from us, or it needs to
Well,
come
we
from
did
us to the
the
Board
press
of
release.
Health.
We could,
Or the Board of
it's
Select-
not been finalized yet, so I don't see why we couldn't.
Add it to
Add-
the bottom.
Right, because I think
Reminder-
there already
Print it
is a
off,
little
you
bit of that in,
A
like, there's
reminder
links
of
to
best
everything
practices.
and that, yeah.
Hey, guys, this is what you should be doing,
Yeah.
whether it comes directly from us or from us to you guys, the Board of Selectmen, who then release it. We can't sit here and not say anything.
Right.
We have
Yeah.
to say something about it.
Yeah, it's in the emails. We don't have it on printed out, but,
Actually had it on paper.
is this the last,
Yeah, I think it got,
the last one we saw?
the one about giving out the tests, but he also incorporated some links about, finding a vaccination and testing, but we could probably maybe have him expand on it a little more
Right.
about our our case numbers.
actually, it was bolded out.
What we sent out with the
Well, it hasn't been sent out
test,
yet.
no, I know that, but.
Oh, yeah. Test and
The
safe.
prior communication, correct.
Yeah, I'm talking about the one we're doing for the take-home test, so that we
Right,
have
right,
ready in draft form, if we could expand on it.
We have in the 1, 2, 3, 4th paragraph of that, in bold, which if it's always being printed.
Right.
Receiving a vaccine, wearing masks indoors, and social distancing are still the most effective tools in reducing risk. And I think that's
That's
strong,
sufficient,
that's
yeah.
sufficient, but I think we need to make sure we are saying that to somebody, whether, like I said, whether it's we're saying it to the town or we're saying it to them, then it needs to be, aside from just this, we're saying something about it, that's all.
So maybe put it on the website.
Website.
Yeah. Just as a reminder, these are the things you can do that will help keep you safe,
Yeah.
Right.
because staying silent is just not a good look at all.
No, it's not.
So you good with that?
I'm good with it as long as
Okay.
we're all in agreement.
All
Oh,
right.
I just got an email. You guys are gonna love this.
Oh,
Your shipment will be delivered Wednesday morning, December 22nd. And I have a tracking number,
Okay, great.
okay? I know, I've been sweating it.
so can we say that publicly now, or do you still want to wait until we get it?
Well, we're gonna have to release,
We're gonna put, so we go with that, what you just read out on the website tomorrow?
Sure.
All right. And, yep, so it says Wednesday morning. Well, that's a relief. Just don't ask me to wrap them, and we'll be fine.
all right, so Jean Marie, anything on your update?
No,
Okay.
it's been a little,
Sue, anything in the office?
Nope, I passed it all over to Jean Marie today.
Okay, great.
she did.
Okay,
The only thing I would just remind you that, as of Wednesday, when the tests are done being handed out, I'm on vacation,
yep,
and I will see you on January 4th.
Next.
And I have left Jean Marie's office cell on the email for emergencies that can't wait for the office to be open, and her email address.
And just for everyone's knowledge, town hall closes what time?
We're closed we're closed, because of the holidays, we're closed the next 2 Fridays and Mondays.
Okay.
So we're closed Christmas Eve, and then the Monday after Christmas,
Mhm.
New Year's Eve, and then the Monday after New Year's, so.
And the normal Monday hours, will those be made up any time during the
No,
week?
we're only open till
Normal-
4:30 next week, yeah.
Normal, regular hours all week, and then we are closed on holidays
Yeah.
per normal holiday schedule.
Yeah.
Okay, anything else? Lisa? Matt? All right. So I will entertain a motion to conclude our meeting of Monday, December 20th.
Motion?
Okay, motion Lisa,
Seconded.
second Matt. Any discussion? Hearing none. All in favor, say aye.
Aye.
Aye. Okay, everybody, have a safe couple of holiday weeks. Merry Christmas and Happy New Year.